Please pause for the invocation and the Pledge of Allegiance, both led by Ms. Fiedler.
Thank you, Madam Chair. Community can mean many things to many people. I've seen a community that has come together during extraordinary times, from food drives to small business incentives, running errands for the elderly, or creating scavenger hunts within communities for kids to have an exciting task amid uncertainty. Our community shines bright. If we can all take a moment to think about our communities, how they've gotten us through this time, and how they'll help us recover together. And now I'll lead the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Secretary, please read the ethics statement.
The Ethics Commission has asked that I advise you that under certain circumstances, members of the public may qualify as lobbyists when they testify before the County Council. If so, the law requires that certain information be filed with the Ethics Commission. The Chairman of the Ethics Commission has asked that those who wish to testify in any form review the General Information on Lobbying sheet located on the Ethics website under Forms and Publications. If there are any questions about lobbying requirements, please contact the Ethics Commission at 410-222-4413.
The County Attorney, Mr. Greg Swain, will now give a statement regarding the Open Meetings Act. Mr. Swain?
Mr. Swain, please unmute.
Thank you. Good evening. I'm Greg Swain, the County Attorney. I just wanted to say a word about the way this virtual meeting is being conducted and the requirements of state law. The Maryland Open Meetings Act requires public meetings to be open to the public and to be held in places reasonably accessible to individuals who would like to attend the meeting. The virtual format of this meeting of the County Council is due to the COVID-19 emergency and is necessary in light of the serious health risk associated with public gatherings, as well as the governor's various executive orders limiting public gatherings. A virtual meeting of this type was not envisioned by the Maryland Opens Meeting Act, but we have ensured that this virtual meeting includes alternative accessibility features that the Open Meetings Compliance Board and the appellate courts have reviewed and approved, such as having a call-in telephone number that allows anyone with a telephone to call in and listen to the meeting, broadcasting the meeting with video and audio on cable TV and on the web, and allowing written public comments to the legislation to be filed with the clerk and to be considered by council. Under these unprecedented circumstances, the public access provided by this technology makes this virtual meeting reasonably accessible to the public and satisfies the transparency requirements of the Open Meetings Act. Thank you.
Thank you, Mr. Swain. We're making every effort to reach the members of the public and include you. Starting today, the packet of important materials that we use during our meetings will be posted as an e-packet on the council website prior to the start of meetings. Look for the button on our homepage. Tonight's e-packet contains the slides for a presentation we will receive from the health officer. In addition, our online testimony tool is up and running. You can use this to submit general comments or testimony specific to a bill or resolution. If we receive comments or testimony early enough, it will be read into the record for all to hear. At this time, I'd like to introduce our health officer, Dr. Kalyana Raman, for a brief presentation and update regarding COVID-19.
Thank you. Thank you, Councilman Pickard. Thank you for having me here this evening. I wanted to give an update on where we are with COVID-19 and also what we should be expecting over the coming weeks and months as well. Had a number of slides. Did we want to do it with me doing slide sharing, or no? Was I to do the slide sharing, or let's see, Joanne, how do we want to do this?
Madam Moderator, behind the scenes, what was the final on that? Was Dr. K going to be doing it himself, I thought?
I'm happy to do that. I wasn't sure. So.
Dr. K is sharing his screen, yes.
Thank you.
A little janky, but that's how it's going to be. So just wanted to give you an overview of what we're going to talk about. I'm not going to read it for you. You have that ability yourself. But just to at least set the stage for the things that we are keyed in on as a health department. This includes kind of the areas that we are driving on, but don't include everything that we are doing, particularly in concert with other agencies. Really focusing here on the specific issues around COVID-19 and health, and we will touch upon those other areas that are impacted by COVID-19 but don't necessarily fall directly under health. So I want to start off with some data. This is our public-facing dashboard. It's data as of yesterday because we submitted those slides this morning. But each day we publish an updated dashboard that has information that is relevant to the public and also helps give a sense of where we are. The top three sections are fairly self-explanatory, but we want to focus on the bottom two rows, particularly on the cases and deaths by race and ethnicity and the cases and deaths by age. Those are two areas that tell us where we see the impact of this disease. When we look at the cases and deaths by age, we see that the cases fairly well mirrors what we see in terms of our population and the age ranges in our population. But the deaths are much more concentrated in the older age group. You can see that the largest number of deaths happen in the 80 to 89 age group. And we're seeing that the average age of somebody who dies from COVID is 80 years old. So this tracks along what we were saying is that while COVID certainly affects people across all age ranges, and it tends to spare those under the age of 20, the deaths we see are predominantly in the older age group and those who are sicker. That said, we are seeing people who are younger, and by younger we mean like 20 to 60. We are seeing that they can get severe disease and indeed be hospitalized, and that is quite common. They're not dying from the disease, but that is a significant portion of the hospitalized patients. We're also looking at cases and deaths by race and ethnicity. This is something we started doing towards the end of last week. One of the things you'll notice is that we don't have data available on race and ethnicity for about 43% of the folks who are positive, and that has to do with how data is collected on race and ethnicity for lab testing. We have an internal process where we're working on getting that data on the positives, and we'll talk more about what that looks like. But just from the snapshot we see right now, we're missing 43% of the data, and we see that for the cases, 17% are Black, 30% white, and then 6% Hispanic, 2% Asian. What's troubling about this is that we're seeing that the percentage of positives in Blacks mirrors their percentage in the population. But that's with 43% uncounted. And so as we find the race and ethnicity data on those uncounted, all three of those categories are going to go up. But in the Black and the Hispanic categories, they're already at their representative demographic proportion. And so those are only going to go up. And that suggests to us that there's a disparity there in terms of COVID-19 hitting those populations even harder than others. And then lastly is the cases by zip code. And these are cases by zip code, and there's a note there excluding congregate settings. And the reason for that is that some zip codes have multiple nursing homes or assisted living facilities, which tend to have a disproportionately higher burden of disease. They serve an older population, and that tends to skew the numbers. We're really trying to show what's the community level spread here. It's really just a different ways of seeing the data. At the end of the day, we have the entire number of cases in the county, so 1,047, and then 46 deaths. And so we update this every day, and we'll continue to work on this, improve it, bring out new data streams as they make sense to what we're looking at. The next thing that we really focus on is education. How are we getting this message out? This is a classic public health issue of educating the public on what COVID-19 is and how do we prevent it. And these next 3 slides are just examples of that. We talk a lot about these, and we have been talking a lot about these. Washing your hands, avoiding touching your eyes, nose, and mouth, avoiding contact with sick people, covering your mouth and nose when you're sneezing or coughing, and staying at home. But the key to this is the repetition, the graphics, and putting this out consistently. We have another example of what you should know about COVID-19, a little bit more dense, a little bit more text-focused, and then some more graphic examples of what social distancing looks like. Much less text, much more visual in terms of keeping your distance, and also helpful suggestions on what you can do. One of the things we heard constantly was, we keep getting told what not to do, what's left. And so we have different messaging strategies that we're using to get across this social distancing and the infection control. A large part of the education is also around when to get tested. And that guidance has been changing over time because, as with almost everything with COVID, we're learning in real time what's happening, and we're applying that in real time. In almost no other situation that I can recall in 20 years have we been in the public health world learning the information at the same time as the public and implementing it. It's a confusing time for professionals, and we spend a lot of time sorting through this and trying to figure out what makes the most sense and what is evidence-based, and it's doubly so for the public. So part of that is testing, and we've talked about the fact that testing is reserved for those with symptoms, so cough, fever, shortness of breath. Initially, we were recommending that only those with severe symptoms, so people who were having fevers that were continuing for typically more than 3 days, shortness of breath, get tested. And that was entirely based on limitations around the number of the tests. We see that test availability is improving, test turnaround time is decreasing, and we see that very viscerally as a health department. We are able to get more tests in hand. We are able to get our test results within about 2 days, no more than 3 days at this point. When I last spoke to all of you, it was probably closer to about 4 to 7 days in terms of getting test results back. So things are getting better. And part of that is making sure that there's testing available. There's multiple opportunities for people to get tested. We have not listed here the primary care practices that are doing it for their own patients. And certainly there are places that are doing that. Chase Brexton is doing that. Anne Arundel Medical Center is doing that with their ambulatory care practices. So is PWMC. Other private physicians in the community are doing that. But we also have walk-up testing sites and drive-through testing sites. So I want to highlight the walk-up testing site. That's something we launched just today in Annapolis at the Community Health Center of Parole. This came out of a conversation from our health equity meeting last week that the drive-through testing sites were limiting to people without transportation. They were located in areas that people could not get to by public transportation. And so we put that out there thinking we'd get probably about 30 to 40 people. We ended up testing 134 people today in a 4-hour span at that site. And the vast majority of them, probably about 126 of them, came there without any orders or without any prescription for testing, we screened them, and as long as they had symptoms, we tested them at that site. We also have our drive-through testing that we do at the annex, the health department's annex building on Harry Truman, and that runs on Tuesdays and Thursdays, and then we partner with MDH to do testing in Glen Burnie at the Beep site. That's Wednesdays and Fridays. So at this point, we have five-day a week testing, and our real intention is to make sure that we get people information about their status. We give them guidance on isolation. So anybody who's getting tested should be in isolation until they get their results. There should be people in their household. And then if they're positive, we will do the contact tracing, and we'll talk about that in a second. But the real key to this is that it allows us to, one, let people know their status, but two, also lets us as a health department know what's the range of spread of COVID in our county. And that's really a key question to allow us to determine what comes next, but also when it comes. One of the important things is that as a DOH testing site, the tests are free for anybody. So if you have insurance, we will charge insurance, but if you're uninsured, we don't charge anything for the test. And that's a key part of how we can make sure that everybody is able to get their test. Now, what happens if somebody is positive? I'm sure you've heard of contact tracing. We've talked about it. And here's a little graphic to help go through what contact tracing is. Now, without contact tracing, if somebody is infected and contagious, they have the potential to spread that to others. And they can do that without showing any symptoms. And then they develop symptoms. And now the people who are around them can know that they were exposed, but they don't have symptoms. And so in that way, the infection continues to spread. Now, of course, we don't do that. We don't want that. So what does it look like if you only isolate those with symptoms? And this graphic shows you that if you put a box around those with the dark red, the people who are asymptomatic will still spread it, and you really wouldn't have done anything. So what contact tracing does, it says, okay, you're positive. Now tell us all the people that you've been in contact with. We're going to put you in isolation, you who tested positive. And isolation means that you're separated from others so that you can't spread that illness. And then we talk to their close contacts, and we put them in quarantine. And quarantine is for somebody who does not have symptoms and is separated from others. And the reason we do that is because those people who were in close contact have a much higher likelihood of developing symptoms and becoming positive. And we want to cut down that chain of transmission. So if we put a big black box around that entire group, they don't have the chance to spread it to others, and we can then contain that infection. Contact tracing is a core of what we do as a health department. That is our job to do that. And we have in this county contact traced every single person who has been positive. So that's over 1,000 individuals at this point. Each of those positive individuals has an average of about 3 contacts, and that's in the context of social distancing closures and school being out. During normal functioning society, those numbers of contacts would be much higher. And so right now we're seeing the effects of the social distancing, and we would have to calibrate our contact tracing as we go forward based on how open or closed our social distancing is. We've built out the capacity to do 100 new cases of contact tracing a day. For comparison, we do 20 contact traces a month during normal times. And so far, we've hit about 75 new cases on our highest day. We are, if not the only county, certainly one of 2 or 3 counties that has contact traced every single individual who has been positive. When we do the contact tracing, I mentioned isolation and quarantine, and isolation and quarantine are critical to this. Now, it's not just you need to stay home. There are people who live in a variety of situations. They might not be home. They might be at a facility of some sort, whether that's a residential treatment, whether that's in that's in a nursing home, whether that's in a homeless shelter, or they may be in an apartment or a house that is very tight quarters, and there really isn't a room to isolate or quarantine in. So those are the kind of factors that we need to take into account when we're doing this kind of work. And so we consider the income issue. Are people who are doing this, are they able to make up that income? Can they survive that shock? Some people can manage that. Some can't. They're not in a position to. Their housing, are they able to manage their housing? Are they housed, first of all? And second of all, in their housing, can they execute isolation and quarantine? And for those who can't, we provide housing. We provide a hotel stay so that we can make sure that isolation and quarantine occurs. Food assistance has been a key part of our ability to isolate and quarantine successfully. And also considering right now, employment is a lot easier to manage and negotiate. But it is certainly something we're keeping in mind going forward, is how do people keep their jobs when we are requiring isolation and quarantine? Along with this, we're also looking at how we're making sure that PPE is available. We have to make sure that a range of facilities have the PPE they need to do the work in, so that they can, A, care for people who are COVID positive or suspected of having COVID, and B, also make sure that they are enacting universal precautions so that even for those people who are asymptomatic, we're making sure that we're not unintentionally spreading the disease. We have distributed PPE to a variety of facilities, hospitals, nursing homes, behavioral health providers, developmental disabilities providers, primary care, reproductive health services, FQHCs, urgent care, child care. And we do this because as the health department, as part of our emergency plan, we are the ones who distribute PPE across a wide range of providers in these settings. Our big challenge is that there are PPE shortages, and that has to do with national issues. Where there just isn't enough PPE production in the United States to meet the demand, because there is need everywhere. In a typical emergency, in a typical public health emergency of this sort, there would be another region of this country that is typically unaffected that would be able to divert their PPE stocks to us. Now everybody is hunting, including ourselves, whether that's as a health department, as a county, our hospitals, our state, and you're seeing interesting and challenging deals go through, like the one that the governor announced today to get 500,000 tests. That is not the usual way we have to buy any of our supplies, but these are the sort of things that are being required of us right now. We've also just wanted to give you a sense of how much PPE we've distributed: over 58,000 N95 masks, 33,000 surgical masks, 4,000 face shields, 32,000 gloves, and 2,000 gowns, but this is nowhere near sufficient. These are the kind of amounts that can get gobbled up within a matter of days across our system. The biggest concern right now are the N95 masks and the gowns. The gowns are actually the bigger pressure point that is rising up, that we are hearing repeatedly, not just from our county and our hospitals, particularly our hospitals and nursing homes, but we're also hearing this from state officials who are seeing this issue across the state. Another major issue we're looking at is hospital surge capacity. One of the things that we've talked a lot about is the fact that the whole purpose behind social distancing isn't to prevent infection, COVID-19 infections, it's to slow it down. And the reason we want to slow it down is that if we do not, we will see that hospitals will get overwhelmed. We saw that in China when this first started in Wuhan province. We saw this in Italy. We saw this in New York. Hospitals can and will get overwhelmed. People will suffer, and our healthcare system will not be able to manage that load. And so all the work that we're doing is to slow that down. At the same time, we still know that as we slow it down, we will see an increase in hospitalized patients. And we're seeing a slow increase in the number of hospitalized patients. And so a large part of the work that the hospitals are doing are ensuring that they have the surge capacity. meaning that they're going to increase the number of beds that they have available. It's a combination of finding space, finding physical beds, IV poles, medications, ventilators, but probably the most challenging piece of that is finding staffing. And they're meeting that through a variety of approaches. One is to reallocate staff, and we've all heard the stories of dermatologists and orthopedists now being on the medicine floor, changing some staff ratios to increase the number of patients per, whether it's nurse or med tech or a physician, and then also finding and onboarding additional staff, whether that's retired staff or staff in administrative roles, or staff or new staff brought in by hiring agencies. And through a combination of that, our hospitals in the county are able to more than double their bed capacity, and that includes their ICU capacity. Based on the projections we see, we expect the surge to continue into May, when seeing the highest point sometime in May, likely the latter part of May, but these are projections and they're subject to change. And we believe that our hospitals, not just our hospitals, but hospitals around the state, are positioned to care for that. And the reason that I say across the state is, if other hospitals don't have capacity, patients will be transported wherever there is capacity. So we're all really interconnected in this. We all need to do our part in it, but we're all interconnected. As part of that, there's what's called alternate care sites. And so those are care sites that are essentially hospital level care outside of the hospital walls. And Arundel Medical Center is standing up a number of beds along that line in tents. They're medical tents that will be, I believe, across the street from their main campus. This is being done in other sites. You may have heard of the Baltimore Convention Center being turned into an alternate care site with somewhere on the order of 250 to 275 beds. These are part of the strategies we're seeing to increase the bed capacity beyond just what's physically available in the hospitals. Part of our mission in the health department is to make sure that we're addressing the vulnerable populations, those populations that are more likely to be exposed to this and to suffer adverse consequences of this. Those are individuals who are in homeless shelters and encampments, nursing homes, assisted living facilities, residential treatment, correctional facilities, and first responders. The first responders are different from the others. They're folks who tend to be in high proximity to people with COVID. The rest, because they're in a congregate setting, are much higher risk because of their inability to get away from others if they develop symptoms, or even if they're asymptomatic. So the work we've been doing with these populations started over a month ago, and it began with providing support. So talking to them about their plans around social distancing, infection control, what their procedures were if somebody developed symptoms, to isolate that person and to provide quarantine. And then we provided additional guidance and education as needed. And we also have the ability, and have used it many, many times, to provide what we call a strike team. So a team that will go out and do testing on site of anybody who has symptoms as soon as they develop the symptoms. And then we will provide any isolation and quarantine assistance as needed. We do that because it's critical to jump on these tests early. Jump on these patients early and test them, so that we can know quickly and isolate them quickly and try to limit the spread as much as possible. We've also done work in the homeless shelters to move some people out of those homeless shelters to essentially create greater space between individuals. And we've moved them into hotel. We've been providing that support to nursing homes, particularly in terms of understanding how they're cohorting, so creating units where there are people with COVID, units where people have symptoms but not diagnosed, units for quarantine, and then units for the remainder of the population. It's been a key strategy of ours, and we saw that about a week and a half ago, the state also launched their strike teams to do the testing. We're already doing that, so we're not relying on them for that. They are able to provide some additional guidance on on isolation and quarantine and PPE, and sometimes provide PPE, which is a critical need. And then they can also, if there is a staffing shortage because of sickness of staff or excessive call-outs, they have the ability to help with that staffing. We haven't had to use that in our county yet, and I hope we don't have to. And then the last area that we wanted to talk about was health equity and looking at how we address disparities by race, ethnicity, income, and geography. And it's something that we talked about in the context of our Healthy Anne Arundel Coalition. We had our first meeting for a Healthy Anne Arundel. We were due to have our second one at the end of March. That was, of course, postponed because of COVID-19. But that health equity work is really core to what we do, which is to identify where the disparities are in health and work to address those specifically. It's part of how we understand, and that's why I showed you some of the data around geography and race and ethnicity. Income data will be extremely difficult to get for the positives. That's not something typically collected in this context, but we're looking at ways that how we could see that in the hospitalized population. By making sure that we're engaging stakeholders, that we're sharing meaning, that we have meaningful community engagement, making sure that we have equitable access to healthcare, and also communicating properly. And so to that end, we had our first COVID-19 health equity initiative. This was last Monday. We had our second meeting today. We had over 100 participants at that time, and we've taken a number of steps since then. One of our key drivers is to make sure that we're actually moving very quickly. A lot of the time when you do this kind of work, certainly you want to move, but you do want to spend a little bit of time understanding the landscape, making sure you're doing things well. We want to do that, but we also know that time is really a huge factor here. And so we took a number of steps last week. We published the race and ethnicity data, which we showed earlier. We committed to having Spanish speakers on our COVID-19 health line, and that is, we have translators right now, but translators are not quite the same thing as having a native speaker. We identified some best practices for communication via social media, and we've asked our partners on this, our community partners, to be a critical part of that by securing commitments from them to communicate through their networks our messages, and looking at how we develop messages with them in partnership. And the last, as we mentioned earlier, was launching that free walk-up testing clinic. And while we did that at the Parole Health Center in Annapolis, we're going to be going to different locations, not just in Annapolis, throughout the county, to make sure that we provide testing in areas where there's less access to either cars or public transportation to get to testing. Those are the areas I wanted to cover today. I could go on probably for another hour. I'm not going to do that, but I'm happy to answer questions at this point.
Madam Chair.
Yes, Ms. Lacey, thank you.
Thank you, Madam Chair. Thank you, Dr. Kellyanne Rahman, and to the entire health department. You're doing a fabulous, fantastic job. It's really difficult to imagine just sitting inside my comfortable house, the scope of what you all are doing.
Excuse me, I apologize for interrupting. I'd like to ask Dr. Kellyanne Rahman if he would stop his screen share so that we can have a person view now. Thank you.
Better?
The question I wanted to ask is, at what point, I know we're still very early in the epidemic. You could say we're at COVID 101 or 102 or something. At some point, I would think we move into a discussion of long-term effects and impacts on our communities. I would think that the Health Equities Group would be talking about that, and maybe other providers. But do you have an early sense of what the scope of the follow-up is going to be and how we're going to be impacted long term?
Yeah. So one of the hardest things about this is that the measures we're taking, the social distancing, have some serious societal impacts, economic impacts that are massive, right? We all know that. And so we're trying to strike that balance of how quickly can we pull out of this large-scale social distancing. The things that we're looking at are, when do the number of new infections start to go down? we're looking at when does the hospital census for people with COVID start to go down? And there's different guidelines, but generally looking for a 14-day, a 2-week trend that is going down. That has to be paired with a regimen of testing, aggressive testing. So when I say aggressive testing, I mean that the day somebody starts to have symptoms, they get tested. They get put on isolation and quarantine for others as appropriate, and that we follow that isolation and quarantine out. That's how we're going to get control of that, because if there's few enough cases and you can isolate and quarantine them, you can suppress the spread. So those two things go hand in hand. At the same time, we need to have enough PPE so that in any of our wide variety of healthcare settings, we have the ability to unintentionally not spread this. And then also making sure that those hospitals continue to have their surge capacity. They're not going to continue to live this way constantly, but they've now put into place these plans where they're able to rapidly scale up, and so they're going to need to continue to have that capacity. So those are the triggers we're looking for. Certainly, the number of tests that were purchased today will help tremendously in getting us prepared, and we're continuing to look at the modeling and look at how this goes.
Madam Chair.
Thank you. Okay, I see that Mr. Pruski had asked earlier, Ms. Fiedler and Ms. Radovian. So Mr. Pruski, you have the floor.
Thank you, Madam Chair. Thank you, Dr. Kay. I appreciate everything you're doing. That was certainly helpful to give everybody the context. I do have 2 questions, though, because as you know, we're like a funnel. The federal government is the top, state all the way down to you. You're at the local level. You're like me. We get the call all the time. And there's 2 questions I would like you to address. Number 1, schools. I know the state superintendent obviously has the authority to open or close schools, and so does our local superintendent. But are they reaching out to local health departments to get your advice about that? And what have you provided? That's question number 1, because I don't want to keep it. And then the second piece is there's been an increase in my district of police officers that have gotten COVID and tested positive. And one of the concerns, and you mentioned it, about having testing available. Certainly, thank you to Governor Hogan and others that are doing their part to bring that in. But let's be honest, we need a lot more tests and a lot more capacity. So my second question gets into what are we doing for our police and firefighters locally? Because ultimately, besides our grocery store workers, the people that are on the front lines that have to deal with people on a daily basis, how are we protecting them? I mean, we're social distancing, limiting, but so if you could answer those 2 questions, I'd appreciate it. And again, thank you for everything.
Sure. So in terms of schools, we've been closely communicating with the schools. I've spoken with Dr. Arlato multiple times. We're working with other staff. We were doing a lot of that, particularly before the state made the decision to close down the schools. Once that state decision came, that was pretty much the end of the activity. But we've been still in close contact around how to manage re-entering schools to get supplies or materials, to look at what might happen as we come out of it. We actually had a phased plan with the schools in terms of how they can decrease the number of activities while maintaining distancing. So those conversations were happening, and they will continue to happen. So I'm confident about that relationship. In terms of police officers, fire, EMS, our first responders, I mentioned them as a vulnerable group, and I didn't really dig into it. But we've been really working closely with them, both at the county and the city of Annapolis level, in terms of making sure that they've got what they need in terms of guidance around how to engage with individuals that they're coming into contact with in the course of their work. The county is purchasing PPE and making sure they have it. We daily provide testing for first responders from 2 to 3 o'clock at the Health Department Annex building on Truman. We've been doing that for weeks. I forgot to mention that piece, but that's available every day, and a number of first responders have taken advantage of that. So they're foremost in our minds about how we make sure that they're healthy as well.
Thank you. And I also wanted to comment, if you don't mind, Madam Chair. I don't know if it's you or your group, but I was told that some of the best practices in the supermarkets not only came from businesses, but also the health department came in and gave some ideas about, the screens between people, limiting space. I mean, obviously there's national things, but whoever did that, I think we're doing a good job, because obviously we're limiting the contact. I noticed that the grocery stores themselves are taking ownership. So again, I just want to thank you for doing that. Anything that we can do to work with businesses and help out, I'm all for it.
Thank you. Ms. Fiedler.
Thank you, Madam Chair. Hi, Dr. K. 2 quick questions, and I'll ask them together to make it easy on everybody. First of all, how long does it take to trace one person under current conditions? And then my second question is, I know we talked a lot about purchasing PPEs, but I would imagine the health department is purchasing more than PPE, hand sanitizer. So are there electronics involved with purchases? What kind of purchases are we making in and above PPEs?
Sure. So in terms of tracing one person right now, because the number of contacts are low, I was mentioning that it's only about average of 3. That's not normal during normal operating. You have many, many more contacts. So right now we can do contact tracing for a new person, maybe about 4, because that's a total of about 16 people to contact. And typically right now they're family contacts, so it's a lot easier to do it. In normal times, one person could probably do 2 contact tracings a day. When I say a contact tracing, that includes the person who's positive and all of their contacts. And then it requires staffing to do those follow-up calls. And best practice is to do it daily, if you can. And we're doing that. So calling daily to make sure that people are doing what they need to do, that they don't have any needs that need to be addressed, that might be barriers to isolation or quarantine, and then checking up on people to make sure that they're either steady or getting better, and intervening if they're getting worse. And then the second question you had was around what is being purchased. And so a lot of it is, hand sanitizer is certainly a part of it. There's a variety of PPE. We went through a list of some of those items, face shields, gloves, masks, gowns, that kind of thing. But then there's also supplies where we're finding that we need to, as a health department, there needs to be a lot more thermometers, for example. People doing temperature checks now. We've had to invest more in terms of computers, laptops, phones. As we're trying to do telework, we've had to purchase more of those, and other agencies have had to purchase more of those as well. So a lot of the changed practices that we're doing, increased cleaning supplies, increased telework equipment, that kind of thing is being purchased. And then we're looking at how we can support our partners. So our nursing homes, assisted living facilities, those kind of smaller facilities that don't have the purchasing power of a hospital, they're the ones who are struggling a lot in terms of getting supplies, both routine and the kind of specialized medical equipment.
Ms. Rodvian, you had a question?
Yes, thank you, Madam Chair. Dr. Kalyana for the wonderful presentation with so much detail and information. I hope this is helpful to folks that are watching the meeting as well in other places. The question was specifically about the parole testing center that you opened up today. Thank you very much. Obviously, if you had almost or over 130 people, you found a place where there was a need. So I have the details to share with constituents who are curious about it. Will that be ongoing? Is that something for now we could rely on weekdays, 7 days a week? I think I heard 10 to 2.
So what we're looking to do is move it around from place to place across the county, and we're planning on having it at least once a week in Annapolis somewhere. And the idea is that we hit different areas so that try to get across that transportation barrier. So the locations are being chosen in concert with the folks on the Health Equity Initiative. So we're not the only ones making that decision.
Okay, so I shouldn't necessarily tell people that they can go there tomorrow because it might be somewhere else tomorrow. Okay, thank you. I appreciate that.
Thank you. Mr. Volke, Ms. Hare, I'll get you next.
Dr. Kelly and Araman. So I guess in listening to your presentation, and thank you for putting that together and providing the information, but one of the things that I didn't hear and that I've heard a lot about from people in my district and around the county is the order that was passed by the county first, but then by the governor, requiring face masks if anyone is to go to an essential business or be in a public place, basically. I guess my question to you would be, what was the evidence or the data that you all were looking at when you made that decision based on sort of the statement that you made that we're not seeing a major ramp up yet in terms of cases? You think that may be more toward the third being in the end of May. So I guess I'm trying to understand what the rationale was for that. That's my first question.
Yeah. So one of the things that I mentioned is that the data is coming, like new research and findings are coming at us fast and furious. And what we were relying on was the finding that masks were not really that effective in preventing you from getting it per se, but in preventing you from transmitting it. And that was in conjunction with the fact that there's more asymptomatic transmission than we had recognized in the beginning, meaning that people had COVID but didn't have any symptoms and were spreading it. And so that was the reason for the mask guidance, was that wearing it does two things. More so, it prevents or cuts down on the asymptomatic transmission, and then also as a smaller part may prevent you from getting it. That was the research that we were relying on for that guidance.
Okay, and I appreciate that. I guess I think the difficulty I have is I understand where the research is. I've read other things that say wearing gloves and masks are only helpful if you're already sick. So I get your point about the asymptomatic transfer. I think what I'm trying to understand is this wasn't just guidance. This was an order that if you don't do it, there are going to be fines associated and other things like that. So it actually went further than just guidance with that. So that's what I was trying to get under or understand completely. I had another question for you about the map. You indicated that 58,000 that you had given away so far is really nowhere near enough. I've had a chance to review the documents that have been provided by the health department, suggesting that you all had somewhere, you thought you might be close to 1,095 masks. I think there were a number of those that apparently was an order you placed that then fell through and you didn't get the masks. So you may have a lower number than that now. But what is the number of N95 masks that you believe is the right number? What is it that we're trying to get to? And I'd say the same thing for gowns and other PPE type apparatus that we're looking to acquire.
So there's two kind of streams of PPE that we get. One is distributed to us by MEMA. It'll either come from state purchasing or from federal purchasing, and that's the Strategic National Stockpile. Pretty much everything that we've given out that I noted on those numbers came from state, whether federal or state purchased. The other stream is county purchased items. And we're looking, and those are some of the deals that you mentioned that had fallen through. It's an amazingly cutthroat purchasing environment for not just for us, for everybody. And we haven't really had an incoming allotments that we've shipped out to other facilities. Whatever we've been purchasing has been used mainly for county employees at this point. In terms of your second question, how much do we need? We're actually right now looking at what's called the burn rate, the term that we use to indicate how much PPE is used in a given period of time, whether that's a day or a week. And right now we're collecting that information, particularly as burn rates increase with increased usage. So I don't have that number for you, but I'd be happy to share it once we compile it.
Okay, and I guess looking at places like New York, New Jersey, even before that, Italy, Spain, some of the other spots on the globe where they've had this, is there a way that we can understand their burn rate to then try to look at when we're in the surge period, what our burn rate would be?
Sort of. Generally it's easier just to understand what people are doing with their stock, and because that's what they're actually doing. The other thing that's affecting burn rate right now is some of the disinfecting technologies that are starting to be used, particularly around masks. We're looking at alternatives for gowns, so whether that's cloth and they're washable or reusable like plastic or ponchos. So some of those things are changing as we speak as well. We're trying to get away from the disposable because there just aren't enough of those.
Okay. And then I guess just to sort of finish up my question, I'm hearing that I'm not close enough to the mic, so I apologize. Hopefully this makes it better. But so one of the things I've been asking, and we'll get into this more when we get into the bill for tonight, but I just want to ask you, since you're here, and I don't want to have to keep bringing you back on and off the screen. I understand that it sounds like there are a lot of plans that are being made for what if in certain places. So what do we do if we need to do a lot more contact tracing? What do we need to do if we hit the surge point? You know, you've got all these contingencies you're working on, which is excellent. My question would be, what is it that you're expecting to do over the next few weeks? Because obviously you're putting these contingencies in place, but I know you're also monitoring sort of the graphing or the trend to see where this is going. So I want to understand, between now and the end of May, when you expect that we're going to see the height of the sort of number of cases potentially, what is it that the Department of Health is going to be doing in that time frame to both get in front of it, manage it, and then sort of flatten that curve again?
Mm-hmm. So the things that we've been talking about, I'll kind of walk you through what are some of the things we see that have probably increased in intensity. We expect that we'll see increased, or we're preparing to be able to see an increased number of contact tracings required. That's just a scalar. The more contact tracing we do, the more staff we need to allocate for that. In terms of doing the isolation and quarantine, the more of that we need, the more we have to make sure that we have housing supports, food supports in place. We've had to do some income supports in very limited cases. We have to make sure that we're working with the hospitals right now to make sure that they can discharge people. So one of the things that I didn't mention in the hospital surge is not just the ability to admit patients, but also the ability to discharge them. We're finding that in general, the length of stay in hospital is longer than average for somebody with COVID, which means that when somebody gets into the hospital for COVID, they're staying there longer, and it's increasing the hospital census. So we've made arrangements to how we can get people discharged from a hospital to a hotel setting, so that we can work on figuring out, okay, what sort of staffing do we need to provide in that kind of setting, particularly if somebody needs isolation and can't go back home, but is well enough to leave a hospital. So we're preparing for those types of activities. We're preparing for, we talked about the PPE, and I'm going to go over that again, but certainly how would we purchase that? We're looking at how do we make sure around the, Councilman Peruski noted the issue with businesses. We've reallocated a good number of staff to providing guidance and education to businesses and county agencies, and that's a large part of what we're doing. We've increased our staffing and our equipment needs, lab testing, PPE, around testing as well. And we've had to do a lot more outreach to a whole range of types of facilities in the county to make sure that we are all in sync. This is a massive coordination issue. So each of those in and of itself, is a moderate expense, but they all add up very quickly. But the real long range where we're looking at is what happens when we start returning to normal. All of the staff reallocations that we've done, they're going to have to be reversed. And so what we're looking at with COVID is we're looking at a new body of work that didn't exist literally 2 months ago. We didn't have a unit that did this much work. And we're going to have to continue that for the long term, in addition to all of the other work that we do. And we have to do those with those protections in place around PPE, around telework. And so those are some of the cost centers that we see that are increasing over the longer term for us. And that's going to be true across other agencies, other organizations, other businesses. I think we're all facing some modified practices that increase cost.
Ms. Hare, I believe you were waiting patiently for a question.
Thank you, Madam Chairwoman. Dr. K, you sort of just touched on it a a little bit. I'm getting some questions from constituents about how the disease is manifesting itself, and we're 6-7 weeks into this now at this point. Do we have any more updates on the length of time that you're seeing people sick for? You mentioned a little bit sort of the extended stay of hospitals. How long, what is the average stay? And other than deaths, do we have any data on the severity that we're seeing and the range of severity that we might be able to publish for people? Are we seeing entire families get sick? If we are social isolating and one person in the family gets sick, is everyone getting sick? Or is it really just that one person and the other person is still asymptomatic? Those sorts of things.
Yeah. So in terms of symptoms, we're generally seeing what has been found elsewhere, which is average time to develop symptoms is somewhere around 5 days. The range is anywhere from 2 to 14 days, and that's why our quarantine is 14 days. But we are definitely seeing that families, when one person turns positive, others are much more likely to turn positive, and that has to do with that asymptomatic period again, because even those who are really diligent about isolating once they have symptoms, because of that close contact, it's almost too late for them. But in terms of severity, we don't really have a great fix on that particular piece yet, and that's just because it's a bit early for us to have that information. We're definitely trying to figure out from our data, particularly as we do the contact tracing, what other symptoms people are having and how long those symptoms are going. So we're working on collecting that data. And we're hoping to have a good sense of that sometime in the next maybe few weeks, month, that kind of thing. But right now it's just a little too soon to know.
Okay, thank you. One more on that. At what point is it safe to assume, I know you're doing a 14-day quarantine, but at what point is it safe to assume someone who we know has been sick is no longer contagious? Is it simply no more symptoms, or do we not really know yet how long that may go?
So the CDC guidance on that is that for somebody with COVID-19, you have to have two conditions. One, you have to be at least 3 days fever-free without medications, and your symptoms are improving and your shortness of breath is resolved. And you have to be at least 7 days after the start of any symptoms. So that's what we're using, and that's the guidance we provide to people in isolation.
Perfect. Thank you so much.
Mm-hmm.
Do we have any other questions for Dr. K? No? Okay, well, I want to extend my gratitude for you joining us again today, Dr. K. This has been extremely helpful and informative. I really appreciate the Health Equity Initiative, as I know my community has a large number of cases and they are rising every day. I received some very sad news that a constituent had passed away, and his family is all recovering themselves, but it's very sad. Yeah. And I think we're all gonna maybe have those stories before this is all over. So thank you for joining us, and I know you'll be today.
Thank you.
Because this is a virtual meeting, we cannot invite people to address the council face-to-face on any general topic or offer testimony on any bills this evening. May I have a motion to suspend Rule 3-105 and Rule number 4-104 for this particular occasion?
Lacey, so moved.
May I have a second? May I have a second? Thank you. Madam Secretary, will you please call the roll?
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volke?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. The motion to suspend Rules 3-105 and 4-105 is passed.
Thank you. Madam Secretary, do we have any comments or communications on any subject not included in the printed agenda received from members of the public to be read into the record this evening?
Yes, Madam Chair, I have 2 statements for invitation audience.
Would you please read those for the record?
The first is from Mike Bork, and he is in Jessup. He states that the Maryland DNR and the governor's stay-at-home orders allow for sustenance fishing. Rockfish or striped bass season opens on May 1, 2020. I trailer my boat and use the boat ramp at Fort Smallwood Park. The boat ramp is closed because of COVID. Many people in the area use the ramp. I believe that social distancing can easily be followed at a ramp. People do not come in contact with each other. Thank you. And Madam Chair, I'd like to point out that this gentleman was the first to use our new online testimony tool that we are urging the public to utilize, which can be found on the county website. Secondly, we have Joyce Rosenkrantz from Millersville. She states that she appreciates the county efforts during this difficult time. There is sincere concern that those housed, now confined to their county, and Medicare-sponsored housing and support are at very high risk to relapse because they cannot attend group meetings. Her niece is in a Brooklyn Park unit. Her disability and addiction are dual demons. There are supposedly possible virtual AA meetings, which she could attend via phone, but I do not know how. The family pays for her phone. To access an app for meetings requires a registered credit card for her phone. She has a 0 credit rating. We have researched ways to do this for her, not possible. Many are in this quandary. Please request funds be allocated to provide on-demand access to virtual AA, NA, etc. meetings for citizens who are victims of the insidious addiction diseases. This is crucial to support sobriety. We have county IT professionals and citizens who could solve the issue to have a virtual meet similar to Google Classrooms or Zoom. Addiction is a lifelong struggle. The pandemic severely affects mobility to attend meetings, which are literally the lifeline. Resolving this access issue would be a force multiplier in terms of outcome at little expense. We have the human capital to fix this. This is a real-life current problem that can be resolved by tasking the OPI for disabilities and maybe IT to provide connectivity to this very vulnerable group. I sincerely hope that you give this issue the attention that it deserves. The outcome can save lives. That is all for public testimony.
Thank you, Madam Secretary. The invitation to audience is now closed. Is there any item any council member would like to place on the agenda at this time? Ms. Stacy.
Thank you, Madam Chair. I would like to extend our congratulations to Miss Emily Davis, who today was named the Anne Arundel County Public Schools Teacher of the Year. She is a language arts teacher at Brooklyn Park Middle School. So thanks for all you do, and congratulations again.
Fantastic. Okay. May I have a motion that the partial reading of any bill, resolution, amendment to a bill or resolution, or minutes constitutes the reading of the whole?
So moved.
Is there a second?
Air on the second.
All in favor?
Aye.
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 Any opposed? Okay, the motion carries. Madam Secretary, please read the minutes of March 16th, March 20th, and April 14th, 2020.
March 16, 2020, the meeting was called to order by Chairman Allison Pickard at 7 p.m. Ms. Pickard gave the invocation, followed by the Pledge of Allegiance. March 20, 2020, the meeting was called to order by Chairman Allison Pickard at 9:30 a.m. Mr. Volke gave the invocation, followed by the Pledge of Allegiance. April 14, 2020, the meeting was called to order by Chairman Allison Pickard at 9 a.m. Mr. Pruski asked for a moment of silence for all who have worked during this emergency, followed by Ms. Fiedler leading the Pledge of Allegiance.
Thank you. May I have a motion to approve the minutes of March 16th, March 20th, and April 14th, 2020?
So moved.
Is there a second?
Hair, second.
All in favor?
Aye.
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 Any opposed? Thank you. The motion carries. The minutes of March 16th, March 20th, and April 14th, 2020 stand approved as read. There are no new resolutions or bills to be introduced this evening, so we'll move along in the agenda tonight. Now that we are in full swing of conducting meetings virtually, we need to get back to all previously introduced bills and schedule hearings and votes. We are going to do a series of motions to accomplish this at this time. May I have a motion that the previous motion to postpone the hearing and vote on bills number 220, 820, 920, 1020, 1120, 1220, 1320, and 1420 until a date still to be determined be amended to provide that the hearing and vote on bills 220 and 820 shall be postponed to May 4th, 2020. The hearing and vote on bills 1020, 1120, 1220 shall be postponed until May 11th, 2020. The hearing and vote on bills 1320 and 1420 shall be postponed until May 18th, 2020. And the hearing and vote on bills 920 shall be postponed until May 26th, 2020.
Lacey, so moved, all of it.
May I have a second?
Hare, second.
Thank you. Madam Secretary, please call the roll.
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. The motion to amend, sorry. The motion that the previous motion to postpone the hearing and vote on bill numbers 220, 820, 920, 1020, 1120, 1220, 1320, and 1420 until the date still to be determined be amended to provide that the hearing and vote on bills 220 and 820 are postponed until May 4, 2020. The hearing and vote on bill numbers 1020, 1120, and 1220 are postponed until May 11th, 2020. The hearing and vote on bill numbers 13 and 1420 shall be postponed until May 18, 2020. And the hearing and vote on bill number 920 shall be postponed until May 26th is passed.
Thank you. May I have a motion to postpone the hearing and vote on Bill 1920 until May 4th, 2020?
So moved.
May I have a second?
Hare, second.
Madam Secretary, please call the roll.
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Nay.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. The motion to postpone the hearing and vote on Bill 1920 until May 4, 2020 is passed.
Madam Chair. I was
Mr.
a nay on
Volkey.
that.
I'm sorry?
I was a nay on that
Oh.
motion.
Apologies, you are correct, sir. 6 in the affirmative, 1 in the negative. The motion to postpone the hearing and vote on bills 1920 until May 4 is passed.
May I have a motion to postpone the hearing and vote on bills number 1620 until May 18th, 2020?
So moved.
May I have a second?
Hare, second.
Madam Secretary, please call the roll on this motion.
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 7 in the affirmative, none in the negative. The motion to postpone the hearing and vote on Bill 1620 until May 18 is passed.
May I have a motion to postpone the hearing and vote on Bills 1720 and 1820 until May 26, 2020?
So moved.
May I have a second?
Hare, second.
Madam Secretary, please call the roll.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. The motion to postpone the hearing and vote on bills number 1720 and 1820 to May 26, 2020 is passed.
Thank you. May I have a motion to postpone the hearing and vote on bills number 2020, 2120, 2220, and 2320 until June 1st, 2020?
So moved, Madam Chair.
Thank you. May I have a second?
Hare, second.
Madam Secretary, please call the roll.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. The motion to postpone the hearing and vote on bill numbers 2020, 2120, 2220, and 23 to June 1, 2020 is passed.
Thank you, everyone. Well done. Madam Secretary, please read the title of emergency bill number 2520.
Bill number 2520, an emergency ordinance concerning current expense budget, emergency and supplementary appropriations, COVID-19 response.
This is an administration bill. I would like to invite Mr. Pete Barron to introduce his panel and discuss this bill for the council.
Good evening. Can everybody hear me?
Yeah.
Good evening. For the record, Pete Barron with the administration. Joining me at the virtual table are Chris Trumbauer from the County Exec's office and Miss Lori Blair Kostmeyer from the Office of Law. In the virtual waiting room, ready and willing to come up if needed, are Matt Power, our Deputy CAO, along with Kay Bachester-Brown, our Deputy CAO. From the Office of Finance, Karen McQuaid and Michael Beard. From the Budget Office, Jim Beecham and Stephen Taru. From Law, Greg Swain. From Health, Dr. Kay and Billy Penley. County Executive Pittman and the entire administration want to express our thanks and deep appreciation to each and every one of you for the resilience and teamwork you have demonstrated during these past few weeks. Putting together these virtual meetings are not easy, and we are grateful to you, to everyone in county government and in our community who have united to work together to address the global challenge COVID-19 has created. As the county executive said in his briefing to you last week, transcendental, the building trust in government, crisis and uncertainty, it is absolutely essential. While these past several weeks have been difficult, we have seen numerous examples of charity, humanity, and community that reaffirm why our county is the best place for all. This council has taken important steps to protect the public while continuing the critical work that needs to be done to ensure the health and welfare of our residents. The executive and the administration will continue to stand by the members. As you just heard from Nilesh, we have more tough weeks ahead. We're going to see an increase, we're likely to see an increase in hospitalized patients, and we expect the surge to go into late May.
Mr. Barron, you appear to be.
Can you hear me?
Now we can, yes. You do appear to be freezing a lot, and we are losing a bit.
Okay, well, I'll just wave at me if I'm still breaking up. I'll wrap up quickly. So this is why we're bringing 2520 before you. The COVID response bill is critically important, and I don't mean to be hyperbolic, but this is one of the most important bills that has ever been before this body. Certainly the most important that I have ever worked on in terms of the real potential to save lives. Before I turn it over to Chris Trumbauer to give you a deep dive on the content of the bill, watching it home with a few important pieces of information. We can't repeat this stuff enough. The county executive, the health officer, many of you have spread the word on these resources. Residents can call the COVID-19 health line 410-222-7256 or email COVID-19info@aacounty to answer health-related questions surrounding COVID-19. For general information, folks can call 410-222-0600, and the call takers do a great job of getting people information they need and get someone who can help answer their questions. A different situation, it affects us all. If you or someone you know needs someone to talk to, the community warm line is 410-768-5522. And that number, emergency calls are handled by staff. The crisis response staff intervene with callers who are having a mental health emergency. That number again is 410-768-5522. All the actions that the county is taking, data dashboards can be found at aacounty.org/coronavirus. In addition, it's there to volunteer and donate. Please do so. You can also watch the county health officers and the county executives' regular town halls on their Facebook pages. Now I'm going to turn it over to Chris Trumbauer.
Thank you, Chris Trumbauer with the
to take over from here.
Chris Trumbauer with the County Exec's office. Greetings from my daughter's bedroom, also known as my home office. Mr. Barron was breaking up for much of his remarks, so I think folks watching at home may not have caught the phone numbers. And I just want to say generally, all that information that Mr. Barron went through and much of what Dr. Kalyan-Araman went through is available on aacounty.org/coronavirus, or you can go to the county Department of Health website, which is aahealth.org. So if you didn't catch those references or those phone numbers, that's your clearinghouse for all of that information that Mr. Barron referenced. Council, what I wanted to do for this bill very briefly is kind of walk through. There's 3 sections of this bill, and they do 3 different things. But I think generally, if you treat this bill as kind of the weirdest budget transfer bill you've ever seen, that would be the appropriate way to look at this. So I'm going to walk through it. The first, you'll see 14 very compelling whereas clauses. I'm going to skip those, but hopefully you check them out. And then section 1 of the bill, what this does is it takes the remaining fund balance that the county has in its general fund and it deposits it in a in a contingency fund for the health department. We're calling it disease prevention and management supplies and materials. So this is 11.75 million that's remaining in the CAO contingency fund. And then it's 27 million additional dollars that's in the remaining in other parts of the general fund. And it puts it all in Department of Health. The reason that we're doing this is because we want the ability to utilize these dollars when there's an opportunity to buy supplies or services that are critically needed to respond to the COVID crisis. We're putting it in Department of Health for two reasons. Number one, because Department of Health has a fantastic finance office that's run by former budgeteer Billy Penley. So we know that that office has the ability to track all this money, to spend it in the right procurement posture and all of that. And also, by placing this in Department of Health, it's quite clear that this will be utilized for COVID, and so ultimately it will be reimbursable by the federal support funds that are coming to the county. I think you've probably heard, I'm sure, about the $101 million of direct aid through the Federal CARES Act, which leads us into Section 2 of the bill. What this does is it creates 18 landing spots for the federal aid dollars that we're expecting. And the way that it does this is it takes a budget character and adds it to 8 different agencies, and some of them get what's called child groups from the parent groups. So that's why there's 18 total. And this is everywhere that we expect that we may utilize the federal dollars. So in order for us to be able to do that, we have to have a place in the budget to put them. So that's why we're creating these in these 8 different agencies. And if you have questions about that, we'll be happy to walk through any of those. But these $1,000 amounts are simply placeholders that create the budget character. So these will be utilized in the future when we get the real dollars, and they will be put in these budget characters for the administration to spend on various COVID-related expenses. And then Section 3 is a little bit different than the other two, where this is a specific federal grant that we received, I believe, through HUD, and that's why this is a specific amount that's going to DSS for the services that were stipulated in that grant. So before I end, I want to say that we worked very closely with the auditor, and she put together, I think, a very thorough and accurate blue letter, which I'm sure the council has familiarized itself with. That details the amounts and the way that this bill works very well. So I'd like to thank Ms. Smith for doing that. And then the last thing I want to leave you with is $38 million seems like a lot of money, and it is. But keep in mind that the county executive declared his state of public emergency, I believe, on March 13th, which was a little bit more than a month ago. And we've already spent about $10 million on COVID-related expenses. So if you think about that timeline and how much longer this is likely to last, I think that that number becomes a little bit more in perspective. With that, I'll turn it over to the council and remind you that we do have our panel of experts available to answer any questions you have.
Thank you. I'm looking at my screen to see if my colleagues have questions at this time.
Madam Chair.
Yes, Mr. Volke.
Thank you. Mr. Trumbauer, I guess I'm trying to understand the burn rate that you're talking about with the money. So you said you've spent $10 million so far. The documents that I've been able to get through the auditor from the Department of Health showed that about $8 million had been spent. Of that, it looked like the vast majority, about 6 of those millions had been spent on N95 masks, but I understand some of those masks didn't come to fruition, some of those contracts fell through. So ultimately, I guess my question would be, number one, what have you spent the money on? And number two, what do you anticipate spending the money on? Because my math over the last 5 weeks at $10 million being spent doesn't quite get us to 38 million over the next 11 or so weeks that we're expecting before the new budget is going to be struck by this council, which should include more funding for COVID-19. So I'm coming up with a figure somewhere in the 17, 20, 22 million range. I'm just trying to understand that. Any insight you can offer is appreciated.
Sure. So I'm going to preliminarily answer your question, Councilman Volke. I'm also going to ask if we can bring Matt Power, Deputy CAO, in for any specifics that he may want to follow up on, if that's possible, Madam Administrator. I think he's in the waiting room. But first, Mr. Volke, it's a great question. And let me preface it by saying we don't want to spend all $38 million on COVID at all, because this money is not cash we had lying around that was just sitting there. This is fund balance that we're pulling out in order to make these purchases as needed in this emergency. So anything that we don't spend falls back to general fund balance, and we would like to be able to plug that into the FY21 budget. And we fully expect that everything we've spent to date on COVID will be reimbursable by the Federal CARES Act money that's coming directly to the county. But since we do not have that money in hand, and since we have made some expenditures and expect to make more expenditures in the immediate future, we do need access to funds to be able to pull the trigger on those deals. As you mentioned, there have been a lot that we've been able to do, and there's been some that have fallen through, but our purchasing division is continuing to look for PPE and other supplies to help us address the COVID response. So since we're doing a mechanism to move money and put it in the Department of Health to be able to spend, whether that amount is 10 million, 15 million, or 38 million, we expect all of that to be reimbursed by the CARES Act. And the last thing that we want to do is have to bring the council back in to approve more money if we spend through some allotment, because I think we would all agree, as Mr. Barron said, this is an emergency, it's an important issue, and we're literally competing against a lot of other folks out there trying to get the same equipment. So we want to make sure that we're able to do that. So I think we're hopeful that we don't spend all 38 million. We have no intention of spending all 38 million, but if the council is going to agree to put any money in this fund, we might as well put all the fund balance in there to just play it conservatively and have the ability to do that with the full expectation that every penny is going to be reimbursed, and we will then be able to use the fund balance as we anticipated originally, which is plugging it into our FY21 budget. And with that, Mr. Power may have some more specifics about what the county has or has not acquired to date.
Sure, can you hear me? I would just add to that, we really, as a health officer stated, we really haven't seen the true human impact of this yet. We are trying to do everything we can to procure PPE and make sure that we have it available. And at the same time, we're not on the other side of the surge yet. So we're going to have housing and temporary shelter needs. We're going to have emotional support needs, economic assistance, taking care of unsheltered residents. We have food access problems, tremendous food access problems already, and we haven't even hit the surge where people are really going to start getting sick. Our aging population no longer wants to go out. We have people that we're trying to get food to. The food bank, as you saw in the Capitol the other day, is donations are way down and the need is double. So I think well beyond PPE, there are a number of things that we're going to need this fund to respond to help save lives and to help keep people ideally in their homes and get them back on their feet once we come out the other side of the surge.
Madam Chair, pardon the interruption. Just a reminder for all speakers, whether council or administration, to identify themselves, state your name before speaking every time you speak, for the folks that are listening in on the telephone and can't see. Thank you.
Thank you, Madam Secretary. I believe Mr. Pruski had the next question.
Thank you, Madam Chair. I read the auditor's blue letter, and I want to thank her because there were, as Mr. Trumbauer stated, many grants and categories that this bill touches. But let me make something absolutely clear, and I think it's important for my colleagues, that we have fund balances every year. We have snowstorms and other things. This is a lot bigger than that. Last night when I spoke with a police officer and his colleague obviously tested positive, somebody else who I know was in ICU luckily got out. It's touching everyone, and I certainly think we're going to have some amendments here that will address the financial and fiscal responsibility issues. But I want to reiterate something. I was on a national call this past week with the Council of Foreign Relations with colleagues throughout the country. They had Wasn't governors, it wasn't the folks who are on TV every day, it's us. Local elected officials, state leaders, and they were stressing the same things that were brought up, that if you have funds to purchase PPE, get them as soon as possible and make sure liquidity is an issue. Because I don't want to be the council person who voted against or questioned something. Of course, everybody has a right to their vote, but we had an opportunity to purchase things up front and to get those resources out, particularly for those that are on the front line, from that end. Again, I think it's very important that we talk about these issues, have these debates, but I think the auditor clearly pointed out, I mean, I don't know how many pages was it, let's see, 7 pages. Very rare that you get a blue letter with 7 pages. So she certainly checked out everything, and I'm sure she will testify later about, the fiscal pieces that are there. But I just want to urge everyone the urgency piece behind it, and I'm sure Mr. Trumbauer and Matt Power can address this. When they're calling these places for PPE, having a family member who works in a hospital, we need to move quickly. And if we don't, again, we're behind the ball to make sure we address some of these areas. And again, I understand that people have questions and want to do that, but urgency is something very important right now. Thank you, Matt.
Thank you, Mr. Pruski. I see a hand up from Ms. Hare. You have the floor.
Thank you, Madam Chairwoman. This is Jessica Hare. I'm not sure if this question is better addressed to Mr. Trumbauer or perhaps to Ms. Smith, but Mr. Trumbauer, you stated that you expect all 38 million of this money to be reimbursed. Some of these grant categories, isn't it possible that those would have a county match requirement that would not necessarily be reimbursable otherwise? And the reason I ask the question is because we're putting sort of a $1,000 number on here as a placeholder. If in fact there's a county match, it's my understanding that the administration could expend that money without council approval and without the taxpayers having the opportunity to consider the expenditure and weigh in on it. And because you said all 38 million would be reimbursable, I just want to make sure whether I have that accurate or not.
So thank you, Councilwoman. We could potentially bring in Michael Beard from our finance department, if you please, because he is really our point person on the intricacies of the grants. And I'd like him to be able to weigh in on that. But as you stated, Councilwoman, we do know that there are some grants that will have a local match. And what's less clear is exactly what the process will be for reimbursement from that CARES Act. So I think I've given enough time for Mr. Beard to join us, and I will ask him to introduce himself and then give an answer to your question. You got to unmute yourself, Mr. Beard, if you please. You're good.
I'm good. Hello, Michael Beard, Finance Office, Grant Accountant. Matching is something we've watched very carefully with the applications for the grants and with the notices. So far, we have not seen match requirements, except we did have one kind of sneak in last Thursday on an aging grant. The general assumption with a lot of the COVID money from the federal government in particular is that counties are already out of money, that this is something they can't afford. And so we're not getting a lot of indication that there will be matches to the grants. The grant that we did have last Thursday that came in, the grantor has agreed that we could match it in kind, meaning we could count spending we're already doing in our general fund rather than have to come up with any new money to do it, because they have also indicated that they understand that everybody's already real tight on the money.
Thank you, Mr. Beard. And let me just add, Councilwoman, I think it was a good question about the match. But if you take a step back and you think about this, the federal government is giving Anne Arundel County a direct payment from the Treasury Department of $101 million and change. It does, as Mr. Beard suggests, it would seem a little odd if they're requiring a match to that after giving us such a large amount of money. The only thing that they've been clear about to date is that those funds cannot be used to supplant lost revenue. They have to be used on expenses that were not budgeted for. And Anne Arundel County is doing, I think, a good job documenting all of our expenses to maximize reimbursement from the CARES Act.
Thank you for that. I see Ms. Fiedler has a question. Ms. Fiedler, you have the floor.
Thank you, Madam Chair. Amanda Fiedler, District 5. I just want to go over some notes that I made when I talked to Mr. Powers earlier this week. Mr. Powers, I appreciated you taking 40 minutes out of your day to explain to me the complexities of the purchasing process that I didn't understand. And I'd like, if you could, when I'm done running through some of these notes, go into a little more detail on purchasing and the minimum purchase requirements quantity-wise, and what that looks like. But what I wanted to know more about was what are we giving out to our county departments versus the private asks that the health department is getting. I've had a few constituents who are also county employees, but also out in the field still, who are taking their own masks and don't have ones provided yet from the department. Social services, our EMTs and police, rec and parks, aging, IMP, DPW for waste management. And then we went over a list of hospitals, pediatricians' offices, addiction centers all over the county that are asking of the health department for PPEs. So if you could just go in very briefly what that looks like, but more specifically, the minimum requirements when you're in the global purchasing market. And then I have a follow-up question after that.
Sure, Matt Power with the County Executive's Office. I think what we had talked about a little bit was sort of the way that things normally are procured for an emergency. We have FEMA, who will pass things down to MEMA, who will then pass things to the health department. And, that system has just not been working the way that it normally would in a natural disaster. So it's as if the entire country got hit by a blizzard, and everyone is now in the market looking for salt and trucks and everything else. In this instance, it's the entire country was hit. Everyone is looking for PPE. We are in procurement wars, so to speak, with our neighboring counties, with other states, with the federal government, and the ability to move quick is really, really important. And so as the crisis has evolved, we've seen that there are some very good actors in the environment that are coming through with their purchases. As the demand has been so dramatic, there's also been some very bad actors who've gotten into it. And so deciphering those that are legitimate and getting high quality equipment and PPE to the county has been something that requires a tremendous amount of time. And then once that has been determined, you need to move very quickly. That said, the more, probably the vendors that are safer, so to speak, and have proved better reputations and have been demonstrated their success are often putting minimums on the amount of PPE for individual purchases. So in some instances that can be 500,000 and 95 masks. They're not going to deal in 5,000, 10,000, even 100,000. And the more reputable are usually the ones in a position to have the higher minimum. So that's another reason why some of these purchases have been in the multi-million dollars as opposed to numerous smaller purchases. Because when you have that quality vendor with the quality product, you want to be able to get it, and you want to be able to get it quickly and jump on those opportunities. Because one of the reasons we wanted this bill is we lost out on a $4 million opportunity simply because the county bureaucracy was just not built to move quickly enough. And this will allow us the flexibility to move quickly, secure that PPE, and get it in so that we can fill a void that the county cash doesn't normally fill. The county is normally just filling for county agencies. In this instance, we are now using the county cash to help out the Department of Health, help out assisted living facilities, help out nursing homes, and to make sure that we can have it on hand in a way to get it to our residents who are in need, preventing future outbreaks in nursing homes or assisted living facilities.
Thank you for that. And my follow-up question, I don't know if this would go to you, Mr. Power, or Dr. K. So the governor announced the 4 criteria that Maryland will need to meet in order for us to start the reopening process. And I think everyone's eager to do that in a very safe way. What I want to know is, what is the plan for Anne Arundel County? We know the criteria, we know how much materials we've used to date. We know what the models are for peaking. Do we have a plan for, this is how much hand sanitizer we're going to need. This is how much we're going to need in staffing over the course of the next 4 weeks. I just feel a little bit like, and maybe you have this information and it hasn't been shared yet, but I don't like just throwing out without a plan. If we need it, absolutely. And I'm going to be supporting this bill this evening after we go through some amendments. I just would like the security of a defined plan, even if it's a projection, even if they're estimates. Obviously, this is a very fluid situation, and so could those projections, but something that lays out a strategy to tackle this is what I'm looking for. Can we do that?
Matt Power with the administration. I do think it would be helpful to have our local health officer answer that while he comes in. I'll just say that I think without question, we don't believe there's any way we will be able to acquire and procure the amount of PPE that we will have the demand for countywide. We're going to do the best we can, but the notion that we are going to be sitting on a stockpile where while this crisis hits is simply not realistic. It's a very tough marketplace. We are going to want to have more than we're going to be able to procure, no matter how much that was in the fund. The truth of the matter is, PPE is more valuable than dollars at this point. And so you can have as much money as anyone could possibly have, and that doesn't mean you're going to be able to secure and procure PPE. But with that, I will hand it over to our health officer.
So the four items that you mentioned, Councilwoman Fiedler, are testing, contact tracing, PPE, and hospital surge capacity. Governor's talking about. I'm going to focus on the testing and PPE side, because I think that's what we're going at. Both of those items are constrained at the federal level. This has honestly been one of the strangest things that I've ever seen in terms of the need to buy supplies, whether that's whatever type of PPE it is, or testing supplies, and honestly to buy as much as you can, because you never know when you're going to be able to buy another shipment again, or whether it'll even come through. I know it's hard to believe that it's this messed up, but it's this messed up right now. When we talk to our partners, we talk about when they're going to run out. We had a conversation with our hospitals today. They're talking about the fact that as we go into the surge, that they are in the position of running out of gowns. And so what we're trying to do is literally buy as many gowns as will be sold to us. If that's 100,000 gowns, it's 100,000 gowns. If it's 200,000 gowns, it's 200,000 gowns. I know that it just sounds weird, but that's the position we're in right now. And we are not even able to project properly what it's going to look like in two months, because we're not sure how we're going to get through the next month. A lot of this has been just crossing our fingers, making as many decisions as we can to try to purchase, relying on state supplies that come through, and honestly relying on the ramping up of production around the world. So I wish I could give you a better projection. I know that we talked a little bit ago about the burn rate on a variety of PPE. That'll help us based on how people are using it right now. What we're finding is that the burn rates are going up as we get deeper into this. We've seen that in our nursing homes, particularly, the amount of PPE they're using is skyrocketed, just as they're trying to use as much of it as they need to prevent infections, but also using these extension protocols. So it's hard for me to give you an answer that's more clear than that. I really wish I could. I think we can put together some sense of that burn rate right now, recognizing it's going to ramp up.
And Matt and Council Member Chris Trumbauer with the County Exec's Office again. Let me just address the other part of your question, whether the County Executive has a plan. I can tell you that he's in constant communication with Dr. Kalyanaraman and also with area hospitals and other health professionals. Putting together a plan on how we get out of this crisis is top of County Executive Pittman's mind. But as the health officer has said, we have not yet reached our peak. And so we don't want to get too far out ahead of ourselves. We're still right now trying to reduce the spread and make sure that we're prepared for when the surge does hit. But the county executive is very committed and very anxious to get a plan to come out of this crisis. And I'm sure that we would be happy to include the county council as that develops.
Thank you all. I appreciate it.
Thank you, everyone. I want to take a minute to remind everybody to state your name every time you start to talk for the record. For the folks listening on the phone that can't see us, our little boxes here. So with that, Mr. Volke has asked to be recognized. Councilman Volke, you have the floor.
Thank you, Madam Chair. Nathan Volpe. Gentlemen, this is the concern that I've been trying to get at in private communications with you all for the past few days, as well as asking questions earlier and now again. And I think Councilman Fiedler's hit on it. And this is the struggle that I'm having with this entire discussion. You're asking us to give you $38 million that we previously appropriated other places, that you've now moved around the county and everything you can to find every loose dollar to be able to put it into this effort. Admirable. Got it. My problem is I have no idea how much PPE you want to buy. And Mr. Power is indicating that there could never be enough. Well, if there could never be enough, then you have to have some sense of how much it is that you need. And that number is yet to be shared. And so it's becoming increasingly frustrating to sort of hear all these good ideas of we're going to do this, we're going to do that. But in the end, you're asking us for $38 million that you fully expect is going to get reimbursed with federal money. And so we at the county don't think of that as our money. I want to time out for a second and just remind everyone at home that whether the money comes from the state, the federal, or the local government, it's still your money because in some form or fashion, you're paying it back through taxes. But with that said, you're asking us to appropriate this $38 million, and I'm just not clear on how you are going to use it, where you're going to use it, what you're trying to buy, what the plan is for the money. And I'm continually baffled because you're all very bright people, and I know that we've got smart people in the county working on this and trying to come up with answers, but it's becoming sort of frustrating to keep hearing the same answer over and over again, which is, we just don't know, we just don't know. I am positive that someone has to have an idea of how much PPE we want to buy, of what the burn rate is. There are other countries that are weeks ahead of us where we can look at their own information to try to gather that. And so I guess that's what I'm looking at, because to me, this feels a lot like a $38 million slush fund as opposed to a $38 million appropriation to the health department. And again, I've tried to do some rational math, which I've explained to all of you, where I've looked at how much you've spent over the past 5 weeks and how much you're going to need going forward. But I don't feel like I'm getting anything from the other side that represents what it is that you're expecting to do with this money. So to the extent anybody can answer that question, it would be very helpful, at least for this member of the council, as we're getting forward and being asked to vote on, as you said, one of the most critically important and crucial bills that this council will ever see.
Thank you. This is Chris Trumbauer with the County Exec's office. Thank you for the question, Councilman Volke, but I have to tell you, I'm slightly offended by you referring to this as a slush fund. This is not a slush fund. This is something that we have worked very hard to bring together, the entire budget office, the entire finance office, Department of Health. We've been working on this for a long time to do one thing: give us the tools we need to try and prevent the spread of this disease and save our constituents' lives. That's simply what we're trying to do. Now, you've asked, what's the burn rate? What's the plan? How are you going to spend the $38 million? Let me flip that on its head a little bit and tell you the federal government has given us a direct payment, or has committed to giving us a direct payment of $101 million with a directive to try and implement policies and get supplies in place to protect our residents. That's what we intend to do. So $38 million is what we have available right now by scrapping everything together. That's a little more than a third of what the federal government has committed to giving us, with the expectation that that's what we need to protect our residents. So I don't think that this is a slush fund at all. What I view this is a very diligent effort from our finance and budget people to literally scrape together everything that has not been unappropriated or is not reserved for something in an effort to let our procurement office purchase the things we need to save lives. It's pure and simple. Is this the way we wanted to do it? No, of course not. But we didn't want this crisis to begin with. But this is what we put together to allow this county to act decisively. As Mr. Power has said previously, we've already missed out on some PPE deals because we couldn't get the funds certified and we couldn't get things put together quick enough. We don't want that to happen again. We want to be able to make the purchases. We want to be able to fund the programs that are needed to protect our residents. And we're doing that, quite frankly, at the direction of the federal government, who has given this commitment for a direct payment to Anne Arundel County of $101 million. Thank you.
Thank you. Do I have any other colleagues with questions for the administration regarding Bill 2520 at this time? Okay, great. Thank you. We will now open the public hearing. Madam Secretary, do we have any testimony received from members of the public to read into the record?
No, we have no testimony on Bill 2520.
Okay, thank you very much. The public hearing on emergency bill number 2520 is now closed. Madam Secretary, please read the title of emergency bill number 2520.
Bill number 2520, an emergency ordinance concerning current expense budget, emergency and supplementary appropriations, COVID-19 response.
Is there any further discussion before we get into the amendments that are already proposed?
Madam Chair?
Yes, Ms. Lacey.
I'd like to comment. This is Sarah Lacey, District 1. In my view, I wouldn't accept any of the amendments. I think the bill as it is good enough, and especially because what we need our health department and our administration to do right now is to be able to, write a check right when they need to be able to swoop in and get what this county needs. And protecting the residents of our county from contracting this horrible disease also protects the residents of the state of Maryland and all the remaining states in our nation. If we're ever going to open up, if we're going to be traveling again, we're all protected. Wherever the money comes from, right now is the time to open the spigot and buy what needs to be bought. And that's it.
Thank you, Ms. Lacey. Any further discussion? Madam Secretary, please read amendment number 1.
Madam Chair, I will read amendment number 1. I want to let people know that the amendment will be shared on screen while I am reading it into the record. Amendment number 1. Services by Section 1 of Bill 2520 to specific expenses related to the public health crisis presented by COVID-19.
Thank you. May I have a motion to adopt?
So moved, Councilman Pruski.
May I have a second?
Chair, second.
Thank you. Ms. Fiedler was going to take the lead on this amendment, even though there are 4 sponsors.
Thank you, Madam Chair. Amanda Fiedler. I think Madam Secretary summed this amendment up pretty well. This came about because, while the federal government is funneling money to our county, there are restrictions attached to those monies, and it was thought that we should have the same restrictions tied to the county funding, that all of the money would be COVID related, or spending would be COVID related, I should say.
Thank you. Would the administration like to respond? Mr. Barron?
Seems like Mr. Barron may be having technical issues, so this is Chris Trumbauer with the County Exec's Office. We support the amendment, Madam Chair.
Thank you. Is there any further discussion? Ms. Rodvian, you have the floor.
Thank you. This is Councilwoman Broadbent. I just had a question for the amendment offerers. Would the determination about what is COVID related be made by the same standards at the local level as the federal level, or do we assume that those standards match? How do we, if there becomes a question as to what is COVID related, how is that determination made? And I'll just leave that there. Thank you.
I'm happy to respond a little bit. I think the thought of adding this language just allowed it to our bill to mirror what the CARES Act says. The CARES Act restrictions, as they've been, are quite, I don't want to say generic, but they are general. So we just added the language, taking it from into the legislative language of this bill. Did the administration have anything to add?
Chris Trumbauer with the County Exec's Office. Not really, Madam Chair, just that I think we are, like I've said before, trying to get everything as possible to be reimbursed by the CARES Act. So that would be one way to think about that, is what we're trying to get reimbursed would be COVID-related expenses.
Very much.
Does that answer your question, Mr. Rodbian?
As good as possible, as best as possible. Yeah.
Okay, is there any further discussion? Seeing none, Madam Secretary, please call the roll on amendment number 1.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Mr. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Amendment number 1 is adopted.
Madam Secretary, please read amendment number 2.
Amendment number 2. This amendment requires the controller to provide interim reports to the County Council regarding the encumbrance and expenditure of grants described in Section 2 of Bill 2520 on a monthly basis, and a final report no later than February 15, 2021.
May I have a motion to adopt?
Councilman Pruski, so moved.
May I have a second?
Hare, second.
So I will, this was, I took the lead on this amendment as I was going through the bill and then speaking with Madam Auditor to understand the bill, as well as with our CAO, Mr. Ben Burge, with the administration, with folks in finance and the Office of Law. Thank you, Ms. Klaasmeyer. What spoke to me was, this is a lot of taxpayer dollars, whether they're federal, state, or county. And so in looking at that Section 2, as we get the $101 million grant from the Treasury straight to the county, I thought in the interest of oversight and transparency, the public and the council would like to see a report outside of the current codified reporting that goes with grants, outside of our budget process for FY20 or FY21, and takes the life of these grants from March 1st through December 31st, 2020, and put in a report to the council beginning, well, for the 30th of every month, beginning in May, so that we can see what is being purchased, what is the encumbrances, the expenditures on an ongoing basis until the end of the current reimbursable period of the end of the year. So that was the thought process behind this amendment. I fully trust that The administration is looking to serve the public good with these funds. I believe the flexibility is needed. I just think it will be both informative and add to the transparency for the council to see, as well as the public to see the accounting over time. Mr. Pruski.
Thank you, Madam Chair. I was a co-signer with you on this amendment. And in my discussion with you, and I mentioned earlier that the auditor normally does not do a 7-page blue letter. And I think that she's asking for minimum requirements to review these items. In particular, this previous amendment and this amendment allow a separate reporting mechanism, and it also allows the federal government to go in. But also, we don't want to be too restrictive in the sense, and I know there's future amendments that will be asked, where we're not going to be able to find this money, because as we go through the budget process, which many of us are going to be doing in May, we are going to hear where future funds will be spent. We'll have a plan that will go forward, be able to ask questions. So certainly, I think at a minimum, and I'm sure the auditor could chime in, that the two amendments, the one that just passed and this one, provide at least some transparency and coordinating of what's there. Ms. Rodvian, you mentioned earlier about the importance of trying to figure out whether it's COVID related or not. I think the council's making a statement to ask the administration to do that as well. It's more of a public statement. I think that's the plan because they have to. But if the council also passes these amendments, it shows to folks that we are so accountable for where the money's going and where things are. So I fully support this amendment, and I hope my colleagues will do as well. Thank you.
Thank you. Mr. Volkey.
Thank you, Madam Chair. I'm glad to see this amendment made it in, and it looks similar to me to some of the language I'll have in Amendment 4, so I'm looking forward to continuing this discussion there. I guess the question that I would ask to the makers of the amendment is, I support the amendment. I think it's a good amendment. I guess why is it that the election has been only for Section 2 of the ordinance and does not include Section 1 expenditures, which are under the general fund?
Thank you, Mr. Volkey. That's a good question. In talking when I was doing my crafting of this, my head and my thoughts went to the $100 million grant, and I figured in the encumbrances and expenditures, all of that would come to light when reporting on the federal dollars and how they're reimbursing the county. And we also have a budget process coming with looking at FY21 budget and the effect of the shortfall or during this the last bits of the FY20 budget. That was where my head was when I crafted this. I really wanted to see the accounting for the grant dollars through the end of the grant period ending December 31st, 2020. Those were my thoughts in crafting the amendment. Mr. Pruski.
I want to also respond to Mr. Volkey, is that these two amendments, it was stated earlier from the administration that guidance has been provided and guidance changed related to these grants. The aging grant that was mentioned earlier, and the auditor is aware of this, had a matching grant. So if things do change, we want to have flexibility, and we'll certainly know that through reporting. And I have full faith in our auditor that she'll be able to sort out these grants and go through the minimum reporting piece. But I want to reiterate again, I don't know about my colleagues, but certainly I will be asking a lot of questions in relationship to the county dollars that we currently have, where our tax rate is for next year, and where our spending is going to be through the budget process. And I guarantee the grant funds that aren't going to be spent beyond those 32 million or 30 million will be a part of that process. And I'm assuming that each director or department head will also include that in their discussion during their budget presentations. And so I think we'll have that process in 2 weeks. We're going to find out a little bit more. So that, again, is my rationale in trying to get at least these two sections back.
Mr. Volkey.
Thank you, Madam Chair. Madam Auditor, I'm going to make a couple statements, and if I get anything wrong, please jump in and correct me. But as I understand it, the money that's coming, the $101 million under the CARES Act, is effectively going to ultimately wind up in these placeholder grants in Section 2 that the administration has put together. With that said, the $38 million in Section 1 is a gap, if you will, or a funding mechanism for the time being until we receive, hopefully on 27 April, which is 7 days from now, the $101 million from the federal government, although everyone is a little unclear as to exactly whether that money is going to arrive on time or not. With that being said, the funds that are coming in from the federal government, while they certainly are grant funds that can be placed into these placeholder grants, in the event that these grants are not fully spent by the end of the fiscal year in June, Madam Auditor, do these grants lapse or do they continue?
Madam Chairman.
Yes, Madam Auditor, you have the floor.
Sorry. So the grants that are in Section 2 are operating grants. So they will lapse at June 30th, 2020, and then be reappropriated in the fiscal year 21 budget. They'll probably, if there's any funds left, they would reappropriate them if there's additional grant term. In which case, most of these, like the 101 has a grant term through December 30th. So that will show up in the fiscal year 21 budget. Any remaining funds, they'll have to put it back up and get it reappropriated in the budget. Does that make sense?
Mr. Volke.
Thank you, Madam Chair. Nathan Volke again. Thank you, Madam Auditor. So as I understand it, these grants, the reporting through the end of December really is a bit overkill and probably isn't necessary to report that long, considering that we're going to see any grant funding again in the budget, which the county executive is set to prepare and release on May the 1st. Am I understanding that correctly?
So what you will see in the budget is the reappropriation of the amount. You won't see, so you won't see the spending. That piece
right,
you won't.
Right.
You'll see the reappropriation of what is left in the fiscal year 21 budget, and you would have the opportunity then to consider whether you wanted to continue that funding or not. But that's how it shows up. And the 101 million, I just want to make sure I say this. There are 18 grants, and the 101 million are 8 of those grants, 1 for each department. And then the other 10 grants are some grants from the CARES Act other than the 101 and some other grants. That makes sense. Got it.
Okay. Mr. Volke.
Thank you, Madam Chair. Nathan Volke again. Thank you, Madam Auditor. So with that, I understand your point then. So from an accountability standpoint, it makes sense to continue the reporting through December, which I understand for Section 2. Would the council have any Section 1 reporting that we would receive from the general funds that are the GAP fund or that stopgap fund? Would we have those under the bill as it's currently crafted? That's probably a question for Madam Auditor.
Madam Auditor.
Madam Auditor speaking. The way it's crafted now, there is no reporting of that general fund expenditure that comes through the health department. You would also, that funding would lapse at June 30th as well. And any, reappropriation would have to come through the fiscal year 21 budget. But any spending, if there is any general fund spending, that stays at the health department general fund and isn't moved to the grant yet, would not be, if that makes sense. That's my understanding. Maybe law could weigh in, but I think that's the way it is with this amendment is for Section 2 spending.
So as this is my amendment, and I was not thinking, and this was not meant to be a report that is currently done through the budget office, through the grants office, through the currently codified. This was definitely more thinking about the general public, and I don't I do believe we're going to be utilizing these grant funds longer than this fiscal year, unfortunately. You know, as I've done my due diligence on this crisis we're in, I don't think it just goes away because the fiscal year ends on June 30th, unfortunately. So this was more asking for a report that would be something easily put up on Open Arundel, which I believe is something the council and the administration is very interested in transparency with the taxpayer and our residents. So it was definitely more a layman's kind of reporting than getting into the weeds of budgeting. We're going to be doing that in the month of May for both the remainder of fiscal 20 and how these financial mechanisms we're talking about tonight impact both the end of our fiscal year now and the fiscal year coming in FY21. That was the point of this amendment. It was outside of the current, as I said, current codified reporting that already happens on a day-to-day basis and protocols within departments and et cetera. Did the administration have anything they wanted to add about this? I see Mr. Trumbauer shaking his head yes. Mr. Trumbauer, would you like to be recognized?
Well, thank you. I was Chris Trumbauer with the County Exec's Office. I'd like to give Pete Barron a chance to weigh in if his Wi-Fi will let him, and I'll be on standby, but the administration does want to weigh in.
Mr. Barron.
Thank you, Madam Chair. Pete Barron with the administration. I hope my tech is holding up. I apologize for the issues today. The administration supports this amendment. I want to say a couple of things. I think Madam Chair referenced this. We are committed to making sure that this information on how the county is spending to combat COVID-19 is available. We have had conversations about including these types of reports on the Open Arundel portal, and we'll continue to do that. I want to make sure that if Madam Auditor has any issue getting any piece of paper from our office, she is always welcome to get to me, and I will make sure that we are providing every single bit of information on this. So we are committed to making sure that how the county is spending these resources, the federal grants that are coming in, is accessible and available not only to the county council, but to every taxpayer in the county. And Mr. Trumbauer, if you have anything you want to add, or if we want to bring anybody up to speak, turn it over to you.
Chris Trumbauer with the Exec's Office again. No, Mr. Barron did a great job. One additional thing, because I think, Mr. Volke, I heard you question the Section 1 versus Section 2 difference. And I mean, the administration's perspective is we would include in this report all of the spending. I mean, technically, I think because we're expecting the appropriation to the health department of fund balance to be reimbursed by the CARES, that would get captured in this grant report anyway. But regardless of whether the amendment speaks to Section 2 or Section 1, the administration wants to communicate in the report all of the spending.
Mr. Volke.
Thank you, Madam Chair. Nathan Volke. Mr. Trumbauer, I'm happy to hear that. Mr. Barron, the same. I appreciate the openness and transparency with which the administration is operating and plans to put that up. So I would hope that you all, when we get there, will support the amendment that will incorporate Section 2 as well in the reporting requirements.
Do we have any other comments on amendment number 2? Seeing no movement here, Madam Secretary, please call the roll on amendment number 2.
Ms. Hare?
Aye.
Ms. Lacey?
Because I think the administration is going to make all this information available in a timely fashion for everyone, and meeting that goal of explaining to lay people how the money is being spent, I don't think it's necessary, and so I vote nay.
Mr. Volke?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
6 in the affirmative, 1 in the negative. Amendment number 2 is adopted.
Thank you. Madam Secretary, please read amendment number 3.
Yes, Madam Chair, and we have received feedback from the public that they would like the amendment on the screen a little bit longer. So it is now up. I'm going to wait a beat before reading, and then we'll ask the sponsor to just wait a beat before explaining after I've done.
Okay. Feedback in real time. May I have a motion to adopt amendment number 3?
I haven't.
Oh, you haven't read it?
Yeah. Okay, I think that's enough time. Amendment number 3. This amendment requires that the use of appropriated funds as matching funds for grants identified in Bill 2520 be approved by resolution of the County Council.
May I have a motion to adopt?
Volkey, so moved.
May I have a second?
Air, second.
Mr. Volkey, this is your amendment. I'm going to let you address the...
Thank you, Madam Chair. Nathan Volkey again. This amendment covers the contingency that the administration has continued to reiterate, which is at this moment in time, the grants that we're receiving appear to not require matching funds. However, in the event that that grant requirements change and matching funds do become a factor in grant awards, any matching funds that are required, if the grant is going to be accepted, needs to come back before the council so that we can look at what we are committing the citizens of this county to pay for.
Does anybody have any comments on that? Would the administration like to respond? Mr. Barron?
Thank you, Madam Chair. Pete Barron with the administration. Again, I hope my Wi-Fi is holding up. The administration has no opposition to this amendment. We recognize the important role the council plays here as the ultimate fiscal authority. And while it's well within the council's purview to require the administration to come back before council for every potential grant that may need a match in this bill, I want to make it clear that this amendment does have the potential of delaying the county's response time. We have mentioned this before. We do not have awards for all of the grants in this bill. That's why we've drafted them as placeholders. Until we receive final award notices, there is uncertainty as to which ones may require a county match. Under section 411-114 of the code, one of the conditions of a conditional appropriation of these grants is that there be sufficient appropriated funds either in the grant special revenue fund or in the general fund for the agency administering the grant. Therefore, if the council accepts this amendment, we hope you will be extremely flexible if the admin needs to move quickly to secure a match, because accepting these amendments will certainly add an additional step in the process in terms of accepting and acting on grant funding. With that, happy to answer any questions.
I see a question from Mr. Pruski.
Thank you, Madam Chair. I wanted to be clear what the administration just stated. So obviously this council is meeting a regular schedule on Mondays, and administrative officer just stated that, announced that we're going to be having another meeting added to deal with legislation. But it's possible that passing this resolution could delay purchasing items such as PPE. I just want to be clear, not beat around the bush. be absolutely clear in the fact of what we're doing here. I mean, I understand we're going to meet, we'll get everything, but I don't want to have a 30-minute debate over whether it's 10 masks or 5 masks. We need to get to the point. You talked about the transparency and other things, but could you answer the question clearly, Mr. Mayor, and on behalf of the administration, that we're going to wait and then we have to have these? Is it emergency legislation? I understand resolutions are a little bit different, but I just want the public to be clear, but also us to know what we're voting on here. Because if it's something that you support, fine, but on the other end, you had a concern. So if you would address that, please.
Sure. Pete Barron for the administration, happy to address that concern. As I noted, it adds another step. I was just putting the flag up there. I don't believe this would impede the administration from purchasing something, but it does add another step, another delay. Fortunately, we have a number of legislative meetings in May, so it's less likely to be a problem. But I did want to put on the record, if the council accepts this amendment, we may ask for emergency action to accept the grant and take action on a match.
Madam Chair.
Ms. Fiedler.
Thank you, Madam Chair. Mr. Beard, this question may be best answered by him. How many grants are up in the air right now? Because I know we said that one may have matching funds required by the county, but none of the other ones do. And how many is that?
Mr. Beard.
Yeah. Ms. Fiedler, I apologize, but I was being brought in while you were asking your question and I did not hear it.
That's okay, I can repeat. Just wondering how many grants we have applied for. I know you said that only one to date has required matching funds. Just an idea of how many don't.
All right, Michael Beard, Finance Office. I'm having some glitching here. I want to make sure you can hear me. Okay. Currently, we are tracking 1, 2, 3, 4, 5, 6, 15 different grant sources. Of those, we have received some sort of notice on 1, 2, 3, 4, 5, 7 of the award, and of those 7, only the aging grant that I talked about earlier, it's actually 8. I apologize, it's really 2 grants on 1 award have some sort of matching on them. All the other grants that we've received notice on do not have grant requirements at this point. I do caution that one of the ones I'm talking about is the Treasury money, and all the requirements over that money are still being written by the U.S. Treasury. They've only issued part of the requirements over that money.
Okay, thank you.
Mr. Beard, while you're still here with us, I would like to ask about the Treasury. It's my understanding that there's Inspector General reports attached to that we'll have to comply with as a county, correct?
Michael Beard, Finance, that is correct. Part of the CARES Act does authorize the Inspector General to come review our spending of the Treasury money. It's a fairly vague requirement, so we expect the Inspector General to weigh in on exactly how they will do that later.
Okay, thank you. Do we have any other questions of Amendment 3? Ms. Lacey?
Thank you, Madam Chair.
Oh, unmute yourself.
Sorry, I let go of the space bar, that convenient shortcut. Sorry. I just wanted to urge my colleagues to vote down this amendment. I think we need to separate out our oversight role oversight and approval role, which is this fiscal role, from the executive role, which is akin to your general managing what's going on in the battlefield. This body should not micromanage what happens with these grants, and in particular, we'll have plenty of time to dissect what was done with the money afterward. But if we slow down the grant acceptance process by throwing in this additional step requiring the 7 of us to coordinate, have meetings, pass something by a 5 votes because it's emergency legislation, I think we're doing the county a disservice, and I can't in good conscience support this amendment.
Thank you. Madam Auditor? You're still, there you go.
Madam Auditor, I just wanted to clarify really something that Michael said. He is tracking 15 grants, and one of them is the U.S. Treasury, which makes up 8 of the grants in the bill. There's 10 other grants in the bill. Any individual grants that aren't in the bill would still have to come down to County Council. So it's just, so I just wanted to put that out there. Of the 10 that are in the bill, I believe 4 have been awarded, and 2 of them, I think one's 200,000, one's 100,000, require a county match if they use the funds for administrative costs, if they use it for community meals or homebound meals, then there isn't a match. And that's, so that's the 2 that are from aging that he's referring to.
Okay, thank you. Ms. Hare, I believe you had your hand up.
Thank you, Madam Chairwoman. Jessica Hare, District 7. For me, I'm going to be supporting this amendment. I think what I'm hearing from the administration is that while it may be an extra step, it's not an overly burdensome one. And in an administration where transparency has repeatedly been stated to be sort of the cornerstone, and this is what they're going for, I think it's actually critically important that we make sure if there's a county match, and it's county taxpayer dollars getting spent, beyond anything that's otherwise coming from the feds, et cetera, that we notify the public in advance. We give them the opportunity. It's posted on the website. We get a chance to take a look at it. I am happy to make myself available to make that happen on a time frame that is quick, expedient, and doesn't delay anything. And I think we heard it won't delay purchasing of anything like that. So I think this is actually a very good amendment that gets at what all of us are here to do, and even what the administration has stated is their goal, and that is transparency for the taxpayers.
Thank you. I'd like to ask a clarifying question, that this bill 2520 covers, did you just say 10 grants, and any grants outside this bill would come down to the council anyways? Is that what I'm understanding?
Correct. The 10, and I should correct myself, the 18 in the grant fund plus the 2, there's also 2 in the community fund that have also been awarded. But yeah, the 10 grants in the grant fund plus the 8 grants that are pieces of that 101 million are what's in the bill.
So we know that aging, it was an aging grant that could possibly have a match if we use the funds in a certain way, but Mr. Beard, you mentioned something that they're already talking about, allowing the county to use in-kind rather than actual cash as the match. Is that correct?
Yeah, Michael Beard, Finance Office. Yes, the indication I got from our Department of Aging today is they will be allowed to use in-kind rather than making a cash match.
So that leaves the possibility of how many of these grants could potentially have a match, a county match?
Right now, all the grants that we have award notices on, except the aging ones, do not have county match attached to them. We won't know until we get all the awards what terms and conditions will be on those that are pending right now. So it is possible there could be matches, but early indications are that the designers of the grants do not want to put matches on them.
Yeah. Okay. Thank you. I am not interested in adding an extra step to these grant dollars and adding an emergency legislative session and an emergency bill to our already backlog of legislation. So I will not be supporting this amendment. I certainly understand if my colleagues feel the overwhelming need to do so. But do we have any other comments or questions about amendment number 3? Okay. Madam Secretary, please call the roll on amendment number 3.
Ms. Hare?
Aye.
Ms. Lacy?
Nay.
Mr. Volkey?
Aye.
Mr. Pruski?
Nay.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Nay.
Ms. Pickard?
Nay.
3 in the affirmative, 4 in the negative. Amendment number 3 is defeated.
Thank you. Madam Secretary, please read amendment number 4.
Thank you, Madam Chair. And again, I will wait a moment before reading so it can be up on the screen for a little bit so people can take a look at it. Amendment number 4. This amendment requires the Health Department to report encumbrances and expenditures of the general fund appropriations in Bill number 2520 to the County Council by June 8, 2020 and July 7, 2020.
May I have a motion to adopt?
So moved. Volkey.
May I have a second?
Hare, second.
I believe this is Mr. Volkey's amendment. You have the floor.
It is. Thank you, Madam Chair. Nathan Volkey. So again, I recognize Mr. Trumbauer took particular umbrage with my comment calling this a slush fund, and I realize that's already been picked up by the Capitol, so I'm sure that that's something that'll be discussed. But my point with it is I didn't call this a slush fund. What I called it was it looked like a slush fund, and this is why I proposed Amendment 3, 4, and thankfully Amendment 5 has actually already been covered by Amendment 2. So my point with that is, in order for us to give the public the type of transparency and accountability that they deserve, considering that we're asking for, as Mr. Barron called it, quote, the most critically important legislation, the most important and a piece of legislation that will save lives. For all those reasons, I think it's really important that because of these unusual circumstances and the amount of money that we are appropriating, that we ensure there's good reporting and there's good transparency. So while I'm disappointed that my colleagues elected not to support me on Amendment 3 and push that forward to ensure there was accountability and transparency in this bill and in this money, I would hope that they would all support this requirement, which further places a requirement, because currently there is none. Amendment 2 does not cover Section 1 funds. So let's be very clear about what we've done and what we need to do. We have a reporting requirement that covers grant funding and reporting as it pertains to grant funding in Section 2. We do not, under this bill, have any reporting requirement for Section 1, which is the almost $39 million funds that we are going to transfer to the Health Department. All this is asking is that the Health Department have to come back and produce a report explaining to the council at 2 points what they've spent the money on. That's all it's asking for. And I think that given the amount of money that we're appropriating, that's not an unreasonable ask. I think given the amount of money, of taxpayer money that we're spending, that's not an unreasonable ask. So I would ask my colleagues to help strengthen what we all proclaim is what we want, which is transparency and accountability. Let's strengthen it in this bill. Let's give the taxpayers what they deserve so they can see, and we as the council, the quote, final fiscal authority, that we have the ability to say to our constituents, this is how your money was spent, and we can tell you right here. So I would ask all of you to support this, because I think it's really important to do what it is that we say we want to do, which is do the best we can for the citizens of this county. Thank you.
Mr. Barron, would the administration like to respond to this amendment?
Thank you, Madam Chair, Pete Barron for the administration. I'm going to ask Mr. Beard to stick around and Ms. Penley to be called. Oh, there she is. So Just very quickly, the administration has committed to providing the information that's required in this amendment. I do want to point out that this amendment does create a little bit of some duplicative efforts and to what we've already committed to, and is a little burdensome on the health department. One of the last things we want health doing right now is producing reports. In fact, this would probably better live in finance. I'm going to ask Mr. Beard and Ms. Penley to comment on that.
Mr. Beard.
Yeah, Michael Beard, Finance Office. Ms. Penley and I spent a lot of time on the phone and lately on Zoom together. I would be very comfortable if there's a reporting requirement added here to let finance take the lead on it. We would work very carefully with the health department to make sure that we have all the information and can complete a sound report.
Ms. Penley, did you want to add something to that?
Sure, Billy Penley, Health Department. I concur. I do work closely with the Office of Finance, but also the County Controller is a certifier of funds and financial reporter of funds. So by them reporting, gives some separation of duty from the Health Department and the Finance Office reporting on how the money has been encumbered and spent.
Madam Chair.
Mr. Volkey.
Thank you. Nathan Volkey again. Ms. Penley and Mr. Beard, and to the Comptroller, if she's listening, I have no problem if everybody wants to work together on the front end to make sure that this is produced or originates with the Comptroller or with Finance or wherever. This is just asking that the department that actually gets the money at some point has to produce the report. I don't see anything in this amendment or in the bill or the law that I'm aware of that would prevent the departments from coordinating. It sounds like there's already a lot of coordination, which is excellent. So it would prevent that by way of this amendment. And with that said, to the administration, I guess I would just ask if there is a commitment to do what this amendment is asking to be done, then what is the problem with codifying it, putting it in the bill so it becomes something that's not just a verbal commitment, but something that's a binding commitment?
Mr. Barron, would you like to respond?
As I stated before, it comes down to who does the report, and we've already said we're going to do it. I don't have a objection to requiring a report that we are already planning on doing.
Thank you. Ms. Fiedler.
Thank you. And I just want to make one quick comment. I understand that this would create another level of reporting, and I'm happy to see that the departments are willing to work together. I want to go back to something that Mr. Trumbauer said in the very beginning of our meeting, and I'm not going to quote him verbatim because I don't know what he said verbatim, but he said something to the gist of, these are extraordinary times, and we've never done a budget event quite like this before. And for that reason, I will be supporting this amendment this evening because I think the uncertainty of moving forward, I think the fact that this is an extraordinary time that no other council has experienced before requires that we do our due diligence, even if it's over and above what we would typically do, to make sure that we are spending responsibly and that we see that in the report in the following months addressing this crisis. So thank you.
I have a quick question. I think it would be to either the budget officer or the auditor. What will we see in the budget process that would get at this information regarding the general fund expenditures, the $38 million we're appropriating tonight? How would we see that in other reporting, or would the council not have that information in other ways? Ms. Auditor.
County Auditor. So the budget will show how much they are budgeting for the health department as a whole. And within that, they would have their Disease and Prevention Bureau, and any of this funding would be included in that if it's going to be rolled over. So that is what's typically shown. Whether they add anything additional, I'm not sure for this year, but that is what you would typically see in the budget. I would most likely dive into it and provide additional information in my presentation, but I'm maybe somebody from the budget office might want to.
Madam Chair.
Mute and unmute, guys. Wow. Mr. Barron.
If we're going to ask for Mr. Beecham, our budget officer, who is waiting in the wings to come up, I think we're going to have to ask Mr. Beard and Ms. Penley to go back to the waiting room.
Okay. Great. May we have Mr. Beecham come forward? Good evening, Mr. Beecham.
Good evening. Thank you. This is Jim Beecham, Budget Officer. As Madam Auditor alluded, the budget would be rather generic in terms of the allocation of those funds. The details will come in the reporting, and the Finance Office has prepared codes for expenditures related to COVID-19 that allow us to track in detail every expense.
Thank you. Does anyone else have any questions? Mr. Pruski.
Thank you, Madam Chair. Again, I have no problem supporting this amendment. I do think it's duplicative in some sense, but they're going to do and report as the admin stated. I just want to be clear earlier about my positions. Anything that's going to limit or delay purchasing of something that could save a life doesn't have my vote. So I just want to make that absolutely clear that, we're talking about reporting here, we're talking about other things, but if there's anything that, we're delaying and it could be saving someone's life or protecting our frontline workers, it's not going to get my support. But I certainly think this is something that, can be added on. And thank you, Mr. Rupp.
My initial concern with this amendment was that it lived in the health department solely, but it sounds like we have quite an extensive team of collaborators within budget, finance, the auditor's office, and health. So thank you for that. I think we are shining a light on good government with the work that's being done currently in Anne Arundel County, and we should all be very proud of that. I think the county executive and his team are really doing stellar work. So do we have any other comments on amendment number 4 before we move forward? Okay. Madam Secretary, will you please please call the roll on amendment number 4?
Ms. Hare?
Aye.
Ms. Lacy?
Nay.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
6 in the affirmative, 1 in the negative. Amendment number 4 is adopted.
Madam
Chair.
Secretary, Mr. Volkey.
In light of, thank you, Nathan Volkey again. In light of Amendment 2 passing, I believe Amendment 5 is not necessary, so I would withdraw that at this time.
Okay. Very good. We will continue on to the final vote for Bill 2520. Do we have any further conversation? Ms. Fiedler.
Thank you, Madam Chair. I had hoped that we would come to a consensus on the grant amendment. I certainly don't want to delay any necessary funds either. It sounded to me like the chances due to the spirit of the grants out there and the grants pending, that there is little chance that those matching funds would be required. We went in a different direction, but overall, I think this bill is important, and I thank my council for working together, or the county council for working together to get some important amendments through today. I know it's a very unusual time, but it's also important for us to be the final fiscal authority and be responsible, and I think we've done that this evening, so thank you.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey again. I just want to clarify, Mr. Trumbauer, I still feel badly about the slush fund comment, so I want to apologize to you. But in light of the amendments that we have now added to this bill, which I think really strengthen the reporting requirements and give the council the reassurance that these funds not only are going to be spent appropriately, but that we're going to know exactly where they're being spent and how they're being spent. With that, I look forward to supporting this bill on the final vote. Thank you.
Ms. Rodvian.
Thank you, Madam Chair. Before we vote, I wanted to say thank you to the Office of Finance and the Office of Budget for going to every last nook and cranny and finding the funds that will allow you to have the immediate liquidity needed to go forward with purchases that will serve our county. So thank you for your hard work in putting that together.
Seeing no other movement of hands, Madam Secretary, please call the roll on emergency bill number 2520 as amended.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Fiedler.
Aye.
Ms. Rodvian.
Aye.
Ms. Pickard.
Aye.
7 in the affirmative, none in the negative. Bill 2520 as amended is passed.
Is there any other business to be brought before the County Council this evening? Wonderful. May I have a motion to adjourn?
Councilman Pruski, motion to adjourn.
May I have a second?
Volkey, second.
All in favor?
Aye.
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 The motion carries. The County Council is adjourned till Friday, May 1st, 2020, unless an emergency legislative session is called before then. Please continue to check the county website for important messages and updates, and please stay well and stay safe. Thank you, everybody, and thank my colleagues for, I think, a very well done virtual council meeting. Good night.